So I'm here with spinal neurosurgeon Mr Plev at his Harley Street consulting rooms in London. Dan, we're just asking you a series of questions about spinal surgery, and one which is often asked is, when should patients consider spinal surgery when they have a herniated disc? So I wonder if you could sort of share your experience of when patients should consider surgery for herniated disc, please.
A herniated disc leads to pressure on the nerve root, which will generate pain, pain being a message from your body down the leg, pain being a message from your body telling you to stop doing whatever you're doing, otherwise you might be making it worse. If that pain is too intolerable, does not respond to any type of oral medication, or indeed you have weakness in your foot, difficulty walking up and down the stairs, feeling that you need to use the banister more than before, or you start tripping because you have a foot drop, or indeed you have no feeling down the leg, either in the front or the left or the back of the leg, or indeed you have bladder issues or changes of sensation in the pelvic floor area, so in between the legs, then you will need surgery.
That'll be the surgery. And are people with herniated disc, are they kind of carrying on without? Not every herniated disc needs to have surgery. So some people will carry on, and then at what point, if they have a herniated disc, should they, pursue conservative, and when would they then come and think about having surgery?
Our bodies are amazing. So less than 20% of the patient will really need surgical intervention on the basis that we are able to heal ourselves.
Yeah.
And if your pain, again, does not respond to anything, then the only option might be, if you have exhausted the oral medication and the injections, is to have surgery. If your weakness is getting worse, so you struggle more and more to walk, if your sensation is worse, then definitely do not wait around procrastinating, because you might end up not being able to recover those functions without freeing the nerve.
So if when somebody has got weakness, or say that pain becomes intolerable, it's useful to get a surgical opinion, and then you'll obviously be assessing as to whether there's an immediate risk from not having surgery, but also assessing how severe that weakness is, whether it's going to get worse, and how that patient is going to kind of follow on from there.
You need some form of an objective assessment. You need a clinical idea at what stage a patient is in relation to the MRI scan, which will show you the extent of pressure. Yeah. Though you treat the patient and you don't treat the images, so you really need to see at what stage the patient is for the next step in his treatment. Really.
Oh, and of the patients that come to see you, say some are discovering they have a herniated disc, and some of them are coming to see you for a surgical opinion, what percentage of people coming with a herniated disc, amongst other things, actually have an operation typically?
So less than 10% really of the patients will require surgery, because most of them will get better with conservative treatment, physiotherapy, will get better with addressing their pain so they can exercise more effectively with injections, and most of them will recover the functions if the disc improves. So the bulging disc and the pressure on the nerve root resolves. Most likely your neurological deficits, the weakness, the changes of sensation, as well as the loss of power will improve with the right exercises and treatment.
Okay, thanks so much, Dan.